Allergies will be an adverse reaction to some form of either a chemical, which is in the form of a food or actual chemical, or sometimes even a pollen or leaf or extracts of a leaf. Any of these things are potential to produce allergies because your immune system has a component of which is built with the eosinophilic system, which recognizes what your body can tolerate, and there are certain chemicals and certain foods, certain things that your body will be unable to tolerate, so it reacts with an allergy, responding either as a cutaneous allergy or sometimes a severe allergy like an anaphylactic reaction where you may stop breathing or blood pressure falls or heart rate goes down and have asystole. It can be as devastating as that. There is some genetic factor, especially when you come to food allergies. There is definitely like egg albumin. There are certain nuts that they have allergies to. Sometimes seems to run in the families. Most allergies, when they develop the allergies, it can start at an early age. And usually by experience, what we have noticed is either by constant exposure to a small dose of the allergen, your immune system begins to accept it and develops a tolerance to it. So naturally, as you get older, you're getting over it. That's one possibility. The other possibility is you have figured those allergies and you stayed away from exposure to those allergies. Every biological thing in the universe, whether it's animal or plant or fungi, or has its own chemical component, and there is no two chemical components which are exactly identical in all of them, although they classify as one particular type of plants. Even in plants, if they are legumes, sometimes you can have a generalized allergy to all the legumes, but there are some who are allergic to maybe one kind of a legume and not to the other kind. And if you are exposed to the allergen, then over-the-counter, a lot of medications are there to help you through minor kind of symptoms like itchy eyes or itching on the skin. You can use some form of a over-the-counter cortisone cream or over-the-counter anti-allergy medication like antihistamines like cetirizine or Zyrtec or Allegra or one of those things. But if it is a severe reaction, it needs immediate care and 911 need to be called. Yes, there is a form of desensitization that can be done. For example, we don't do that often to foods, but we certainly do to some drugs, especially penicillin allergy some people have. And penicillin is still today, in spite of being there for almost 90 years, is a very wonderful drug for a lot of bacteria. Penicillin is the ideal drug, but they are allergic to it. And a lot of times penicillin allergy just go through their medical records that somebody wrote because they got the penicillin shot and felt nauseous and they said allergic to penicillin. That may not be real allergy. So if you need to use a penicillin medicine only for that particular sepsis or something, then they can be desensitized. Number one, they can be skin tested for if it is real penicillin allergy or not. They also do it in the conjunctiva of the eye, the allergy testing. And if it does prove, then they start with a 1 in 10,000 dilution injection and slowly increase it over a period of a few weeks to develop a ability to tolerate the penicillin.